Module Overview. Pharmacodynamics refers to how drugs exert their effects on the body after they reach their site of action. It answers the crucial question, what does the drug do to the body? This includes the mechanisms of action, receptor binding, dose-response relationships, therapeutic effects, and toxic effects. This module enables you to understand the molecular and cellular mechanisms by which drugs bring about changes in physiology and pathology, and how those changes translate to clinical outcomes. Mastery of pharmacodynamics is essential for rational drug selection, dose optimization, understanding adverse effects, predicting interactions and variability in response. Mechanism of drug action. Drugs interact with biological targets such as target examples and function. We will use them in a table. First, receptors, beta-adrenoceptors, opioid receptors, signal transduction. Second, enzymes, COX, aspirin, ACE, captopril, inhibition or activation of chemical reactions. 3. Ion channels, sodium plus, potassium plus, calcium 2 plus channels, modulation of electrical signaling. 4. Transporters, SSRIs, diuretics, movement of ions, molecules across membranes. 5. Nucleic acids, anti-cancer drugs, antivirals, alteration of genetic or protein synthesis. Drug-receptor interactions, agonists, mimic the action of a natural ligand, e.g., adrenaline. Bind and activate receptors, can be full agonists, maximum response, or partial agonists, submaximal response. Antagonists block receptor activity by competing with agonists. Competitive antagonists bind reversibly. Effect can be overcome by increasing agonist. Non-competitive antagonists bind irreversibly or to different sites. Inverse agonists bind to the same receptor as an agonist, but produce the opposite effect. Dose-response relationship. Graded dose-response curve. Illustrates intensity of response versus dose in a single subject. Parameters. Efficacy, Emax, maximal response achievable. Potency, EC50. Dose required to produce 50% of maximal effect. Quantile dose-response curve represents the all or none response, e.g., sleep, no sleep in a population. Used to calculate ED50, dose effective in 50% of the population. 50 LD, dose lethal in 50% of the population. $50. Dose toxic in 50% of the population. Therapeutic index and safety margin. Term and definition will be used in a table. First, therapeutic index ratio of LD50 to ED50. Higher value equals safer drug. Second, margin of safety reflects difference between therapeutic and toxic dose. Third, selectivity ability of drug to affect one target without affecting others. A narrow therapeutic index, e.g., digoxin, warfarin, requires close monitoring due to a small difference between therapeutic and toxic doses. Tolerance, tachyphylaxis, dependence, and sensitization. First, phenomenon description. Second, tolerance, decreased effect after repeated use, e.g., opioids. Third, tachyphylaxis, rapid development of tolerance after few doses, e.g., nitroglycerin. Dependence, physiological or psychological need for the drug. Fourth, sensitization, increased response upon repeated exposure, rare but seen in some drugs. Factors influencing drug response. Age, children and elderly respond differently due to receptor sensitivity or organ maturity. Genetics, polymorphisms can alter receptor structure or signal transduction. Disease states, alterations in target tissues or receptor numbers, e.g., beta blockers in heart failure. Drug interactions, synergistic, antagonistic, or additive effects. Tolerance and desensitization. Chronic exposure can downregulate receptor numbers. Summary of pharmacodynamic principles. Concept and key point will be used in a table. 1. Mechanism of action. How the drug works at the cellular, molecular level. 2. Receptor theory. binding, activation, inhibition, and downstream effects. Third, dose-response relationship determines potency and efficacy. Fourth, therapeutic index assesses drug safety. Fifth, interpatient variability influences personalized treatment approaches, accreditation alignment. This module is designed to meet the learning outcomes of ACPE, Accreditation Council for Pharmacy Education, EFPIA, European Federation of Pharmaceutical Industries and Associations, PCN Nigeria, Pharmacists Council of Nigeria, GPHC UK, General Pharmaceutical Council, WHO Pharmacology Competency Framework. You completing this module can apply receptor theory to clinical decisions, analyze drug-response relationships, predict therapeutic outcomes and adverse effects, differentiate among agonists, antagonists, and partial agonists.